Hello, and welcome to the third event in the Health System Innovation Series that Matter is producing together with AVIA. I'm Stephen Collins. I'm the CEO of Matter. We are a healthcare technology incubator and innovation hub with a mission to accelerate the pace of change of healthcare. Functionally, we do three things in service of our mission. First, we incubate startups. We launched in 2015, and since then have worked with more than 850 companies that range from very early to growth stage startups, and we have a suite of services to help them at every stage of development. Second, we work with large organizations, health systems, life sciences companies, payers, to help them strengthen their innovation capacity. We help them find value in emerging technology solutions, empower internal innovators to unlock the value of their ideas, and create a more human-centered healthcare experience through system-level collaborations. And third, we're a nexus for people who are passionate about healthcare innovation. We bring people together to be inspired and learn and connect with each other. We produce a lot of programs, including large-scale events for the broader community, as well as small forums that are exclusively for our members. We are delighted to work with AVIA on this four-part series on health systems innovation. And today we're joined by a group of experts from leading health systems, Providence, BJC, and Memorial Hermann, to discuss how health systems measure the value of new technologies and digital initiatives. AVIA's Senior Vice President of Enterprise Digital Performance, Peter Bressler, will moderate the conversation. He has more than 35 years of consulting experience, and he works at AVIA with the industry to help them better understand the value that's created by their investments in digital solutions. If you have questions for our panelists throughout the program, please put them, use the Q&A function. Peter will weave them into the conversation as appropriate. And with that, Peter, thank you, and thanks to AVIA for this terrific collaboration. And I'll kick it over to you to begin the discussion.
Great. Thank you very much, Stephen. We really appreciate the opportunity to share some insights with you today. Just to get this going, I would love to have each of our panelists introduce themselves. Ali Cazador from BJC, Doug Grabsky from Providence, and Lucky Rai from Memorial Hermann. So Ali, maybe you can just give a brief introduction, and then we'll jump into the questioning after the intros.
Great. Thank you, Peter, and thank you all for coming to hear a little bit about what we have to offer in terms of our experience in this innovation space. My name is Ali Cazador. I'm the director of our Healthcare Innovation Lab supporting BJC Healthcare and Washington University School of Medicine. I've been with the organization for just over 4 years now, and my role is to enable our organization from both an academic and non-academic perspective to really look towards the future of how we can advance care delivery for our patients and our community. Previous to this, I've spent a little bit of background in consulting as well as in the performance improvement world, supporting health systems across the country, and really excited to bring my experience to how we inform healthcare for the future.
Great. Lucky, maybe you can go next.
Yeah, thanks to AVIA and Matter for putting this together. My name is Lucky Rai. I'm Vice President of Digital Channel Experience for Memorial Hermann based in Houston, Texas. I'm an outsider to healthcare. This is my second year here in the industry, learning a lot and learning very quickly, but always in digital transformation in my roles. And my responsibility here at Memorial Hermann was really to create a product model around all the digital engagement channels that we had in our digital ecosystem, and how we interact with patients, and ultimately how that facilitates downstream workflow and our operational efficiency in order to deliver better health outcomes for the Houston community. I mentioned I'm an outsider to healthcare. I come from telecom, retail, and a background in nonprofits, including universities prior to this, but always, like I said, with a focus on digital transformation and trying to use digital channels to drive value and change consumer behaviors.
That's great. Doug, why don't you go ahead?
Thanks, Peter, and good morning, everyone. I'm happy to be here, excited to be here. So I'm Doug Grabsky, Digital Strategy Manager from Providence. So Providence is a integrated delivery network up and down the West Coast, covering about 52 different hospitals, so pretty big network across the West Coast. And my group's actually tasked with incubating new technologies and platforms within the health system for generally consumer patient facing technologies, and then bringing them to the market and actually commercializing them. So I'm kind of going to bring the perspective of how do we instrument and build those new technologies to this conversation. And prior to Providence, I'm a healthcare lifer, so I've worked on just about all of the different aspects from payers, pharma, and providers. So kind of seen it all.
That's great. Thank you. We're very much looking forward to all of your comments today. Just a little bit of quick background if folks aren't familiar with AVIA. AVIA is the leading organization that is helping health systems transform themselves using digital. We have a network of about 60 health systems across the country that are all committed to partnering together to drive improvements in financial performance, clinical performance, operational performance, and are really just thrilled to be able to bring some of this thinking to the group today. AVIA also supports solution companies through our AVIA marketplace, and really want to make sure that we're enabling them to be successful in making sure that they're bringing their best capabilities to health systems all together between our health system perspective and our solution company perspective, really helping to fulfill our mission of transforming healthcare. Today's topic is, I think, really, really interesting. As everyone is aware, the health system industry has encountered some of the most challenging financial times ever in the last couple of years. Even post-COVID, I think there's been some extreme challenges. So certainly what we found working with health systems, and I would expect from solution companies, actually driving change through organizations by deploying digital is increasingly challenging, in part because there is a intensive scrutiny on the return on investment, the value proposition, the business case, given all of the financial challenges that are happening. So what we're looking to do today is really share some insights from the health system perspective through our panelists about how do they think about value, what is the type of analysis they do, what type of metrics are they looking at, to really serve as some guideposts to the solution company attendees who are on the call today, to really understand how to shape and craft their return on investment messaging and analysis to really make sure that everyone is really crystal clear on that so we can all drive the transformation that we're looking for. I'll mention just a couple of key principles in our work that we've done in AVIA around this that might set some framing for the conversation. First and foremost, we're seeing that compelling business cases have to have a clear tie to the strategic and business objectives of the institution. The financial objectives, the clinical objectives, quadruple aim, all that good stuff. There has to be a really clear tie between the solution that you're considering and the ultimate business objectives that you're trying to achieve. The second element is this notion of creating a value story, both in words or pictures and in numbers. And we find it's really helpful to do it in that order. We've seen some solution companies come in and start throwing a lot of numbers at health systems. And I think without the proper context and alignment about what is the underlying value proposition, it's really helpful to have that established and aligned upon before moving into the numbers. The third element or principle that we find is having organizations take both a microeconomic and a macroeconomic perspective. So think about the microeconomic as, what is this solution going to do for a patient, a provider, a invoice, a piece of the supply chain, because if you can't prove the value for one individual, you really stretch credibility to try to scale that up to the institution as a whole. So micro and macroeconomics is really important. And then finally, this notion of being extremely transparent about assumptions. The healthcare world and digital is all very new, and many folks like clinicians often expect really detailed, analytics that they're used to in the clinical world. Some of that may not be available in the digital world as you're looking towards transformational activities. So being really, really clear about assumptions and being transparent about those to support the conversation we find is very important. So again, we'll indirectly touch on all those principles during the course of the day today, but thought that might be some helpful context. With that, I'm going to actually ask Ali to kick us off today and talk a little bit about some of the major initiatives that she's got going at BJC, how she and her team think about value and ROI, and then we'll move on to some of the other panelists and get their perspective as well.
Yeah, I appreciate it, Peter, and appreciate the grounding principles there in terms of how AVIA thinks about just creating value and how we translate that to our health systems. So for us here at BJC Healthcare and Washington University School of Medicine, within the Innovation Lab, we've been really, I think, diligent and intentional of how we define innovation. So for us, innovation is that we catalyze care delivery innovations through research and development. And what we do during that R&D process is we're really trying to understand, does that new idea or concept create value for the organization? Now, value can be a really broad term. For us, we think about how we execute on this in three functional areas. So how are we aligning to the current health system priorities and challenges? I think that Peter aligns to your point earlier around how are we tying these to strategic priorities, opportunities for health systems. The second is, how are we thinking about the emerging innovations in care delivery holistically? What are we seeing on the horizon in the healthcare market? How are we seeing our competitors compared to what we are doing here within our own ecosystem? And then third, how are we promoting a culture of innovation? And so we take that lens as we're not only understanding the internal problems that our organization is trying to solve, but we match that with what is occurring within the market and the vendors within that problem ecosystem, if you will. From there, what we then do is we translate that into an active portfolio of opportunities that we're trying to solve. And for us, again, what we resonate to are those three functional areas of current system priorities, emerging innovations, and innovation culture. Now, there are a subset of questions that we typically like to ask any solution company internally as we think about, is this the right fit for us in solving the problem? It's, are we solving a strategic problem that is rising to the priority for our internal stakeholders? Second, do we have an internal stakeholder who is really going to be the operational partner long-term? Innovation itself cannot sustain a solution long-term. And so it's really important for us to understand who are going to be our internal stakeholders or internal operators who, if we show that a solution creates value, that they would continue that on long-term for it to be truly sustainable. The third is where we ask, what's going to be our return? Whether that be an ROI, a value statement, and I'll get a little bit into how we define value in a moment. But what are those early signals that would tell us that, yes, we are going to see some level of value contribution from this potential solution? And then we ask the question, is an innovation really needed here? We're really diligent about really trying to understand our landscape internally. Are we fully optimizing the just capabilities that we have, or do we truly need to go out into the market to understand how we can pull in a third party to partner with us to solve this strategic opportunity? So to answer your question directly in terms of how we think about value, we think about this in terms of 4 domains of measurement. The first being adoption. And we think about this in terms of what is our adoption rate from our end users. End users can be our clinicians, our operators, our patients, but it's really important for us to understand where adoption is going to occur in the utilization of said solution. Now, when I'm talking through these various different domains, you can also think about them in terms of leading and lagging indicators. The second domain that we typically look at is clinical. What are going to be your expected outcomes that we should see from a clinical quality perspective? Peter, again, you referenced this in terms of the quadruple aim and what have you. Third, we think about the financial, and this is where we get a bit more into some of those lagging indicators, but we really tried to understand what are those direct contributions that we should expect to see from any sort of implementation of a solution. And then fourth and final, and in no particular order, I should say, is satisfaction. What is our satisfaction going to look like from our providers, from our end users, from our patients? And this can be a mix of both leading and lagging indicators, depending on how you're measuring this. We do this in several different ways using human-centered design, user research, patient experience surveys, and the like. But that's a little bit of the framework by which we orient ourselves as we start to navigate any solution partnership that we may get into.
That's terrific. And I know we'll come back a little bit later. I know during our prep, you talked about some work that you're doing in the workforce space, which I think has so many of those characteristics that you raised there. So we'll double back on that one. Lucky, maybe you can give a little bit of context about how you're thinking about this, and particularly interested in your experiences in other industries and how that is, or in often cases isn't, being applied in the healthcare world, and what learnings might be there as well.
Yeah, I think all the things Ali mentioned, very, very much we align with as well when we start to evaluate value of a solution or a problem. I think one of the biggest learnings I took from my time in other industries is really centering back to a value conversation about what customer problem are we really attempting to solve, and are we able to measure the value associated with solving it? And I think in a lot of times, in a very black and white world in healthcare, there's a lot of gray in the assumption sets that we go through when we're evaluating solutions with partners. And we really expect that partnership to help us drive some of those value assumptions so that we can make sure that we understand when and how we will achieve that ultimate value. And I think the challenge in all transparency is that could be dollars, but it could be any number of measures across a number of ways that we measure progress for the organization or for how we want to deliver care for the Houston community. And I think that's always a big challenge, is when we meet with solution partners, especially in some of the work that we do, the very first thing everybody wants to hammer home is ROI. But I really want to take a step back with my solution partners and somebody who's really going to partner with me to understand what are the other things in addition to ROI that will actually allow us to be successful over time in the adoption of a solution that you guys, that these groups may be able to offer us. And we think about it in several constructs: consumer engagement, experience improvement, obviously operational and clinical outcomes. And then ultimately also in the same vein as Ali, what is our consumer satisfaction metric with what we're trying to adopt, whether that's an internal or external customer, and how do we continually use that data to evolve a product roadmap that's now associated with a solution that we may implement. I think a lot of the time we take a step back and say, okay, now that we know what problem we're trying to solve, is there a platform within our organization that can help us to solve that problem, even if it's not to 100% of solve what we would consider a solve, but to help us make incremental progress against that problem? Or is it truly something that we need to go partner with others for? And then we also like to take a little bit of a tangent approach to understand what's the opportunity cost of attempting to solve this in comparison to all of our other priorities that we have right now. And again, in full transparency, Memorial Hermann's going through an EMR transformation right now. We're moving to Epic over the next several months. And so this idea of opportunity cost and prioritization has really become a pivot point for how we think about prioritizing solutions that have value for the organization, to make sure that we don't get less quality outcomes or sacrifice value on all the other things we're trying to work on, because we already know that they'll have a net benefit to us over the long term. And so I think that that's been a traditional challenge for our organization to encompass, and something that was not an established process when I moved into healthcare, about how you evaluate value, not only for today, but also for our strategic imperatives for the next 2 and 5 years. And will it bring us closer to the outcomes we actually want to see as time progresses? So I think that's been a little bit of the challenges that I've seen as I've come into the industry, Peter.
That's terrific. Terrific. Doug, love some comments. I know you have that interesting challenge. I know you have some of this as well, where you are not only considering the value that your efforts are creating within Providence as an entity, but you also have commercial aspirations for some of this work as well too, which I think provide some unique pivot points, if you will, in terms of the kind of dual objectives. So Doug, maybe you could just give a brief overview of the way that you're thinking about measuring value and impact, and we can go from there.
Yeah, absolutely. Thanks, Peter. And I'll start by saying totally agree with Ollie and Lucky on that framework, right? I think we've all aligned on very similar kind of 3 or 4 sets of pillars, right? And I pulled up mine, but realized that the other panelists already kind of covered on the right way to think about it. Everyone's going to talk about it a little bit differently, but I think everyone's kind of reaching that general alignment. So at Providence, for a little bit of context, we set out Providence as a big facility. We realized we had lots of different point solutions. We had lots of different points of view on what our digital strategy approach was going to be. And what we realized when we were looking at like the ROI and all these different point solutions, what are we getting out of them? One of our biggest challenges was actually just being able to get those solutions into the hands of patients. So we saw just that conversion rate when we were looking at the ROI on the usage of those individual point solutions, whether it's a same-day care tool or whether it's a digital surgical pathway. They weren't getting adopted as much as we wanted them to be. And so we kind of we took a step back, realized that there was an opportunity to create a much more identity-driven way to recommend and eventually get those tools into the hands of patients just through different channels, but all aligned to a single set of identity, single set of credentials. So that's a tool we've been working on a lot internally. It's now driving all of our digital experience for patients. So patient logs in, gets the same exact experience when they log into the web, same exact experience when they log into our mobile app. And what we're seeing is we're able to systematically drive a lot better conversion into those other tools and into those point solutions that was kind of previously really lagging. And when we looked at the data, we just weren't getting that conversion rate that we ultimately needed for those tools, those technologies to really be effective. So we've kind of taken a step back and I don't want to say re-architected, but really kind of re-looked at how we distribute all those, how we manage that overarching consumer experience, and by aligning it all back into a single set of identity credentials, being able to federate that identity that we now own rather than Epic. Essentially, we can get much better conversion and actually push those tools to the right patients in a really like systematic, personalized way. And so this is a product we've been working on for several years now, but really starting to get really good, strong results, and then actually be able to measure a meaningful ROI on that platform as a standalone product as well. So something we're really excited about seeing some of that come to fruition.
No, that's terrific. And several of you mentioned the whole concept of adoption, Doug, in terms of some of the enabling technology that you're creating at Providence, and Ollie, some of the work that you've done. I'm trying to also think about the member of the audience today in terms of a lot of solution companies. And one of the things that we found in doing economic and other modeling work for health systems is that drivers like adoption ultimately are huge levers on what the ultimate ROI is. And in some cases, some of those adoption drivers and factors ought to be part of what the solution provider is bringing to you, whether it's the UX of the tool itself, whether it's the training, all of that. But honestly, a lot of that is within the wherewithal of the customer, of the health system itself. And I know sometimes when we've done some modeling, certain projects can turn from being a negative ROI to a positive ROI, directly dependent on what assumptions you're making around adoption. So I'm wondering if you all have any suggestions or advice or comments that might be relevant to the audience today about, like, how do you have a very frank conversation about, hey, we as the solution company are going to do what we're going to do, but you as the customer have to do what you need to do in order for this to come alive. So I'm curious about that dynamic. Ollie, I see you nodding your head there. I'm curious how you do it. Do you use SLAs? Do you how do you actually have that conversation of moving the needle on the drivers of value as you're working with some of the partners?
Yeah, the reason I was anxious to hit the unmute there and was nodding is I'm really passionate about this because I think it's so important for solution companies to understand the health system's priorities and problems that they need to solve. And I think what's been a really useful and effective tool in that is really grounding that in storytelling and human-centered design and understanding what the consumer journey is. We've learned a lot from our digital colleagues here at BJC and WashU around just how we think about personas, how we think about journey mapping, and really orienting that to the problem that needs to be solved. So solution companies can also have that same framework in mind of how a particular solution is going to solve a problem towards those personas, towards that journey mapping. That then gives me the ability to then enable our internal stakeholders to think about the people, the process, not just the technology itself. We really think about that in terms of a trifecta. A solution alone, a digital solution at that, is not going to be successful from an adoption standpoint if you don't think about the people and the process for which the various different touch points in which they're going to interact with said solution. And so how we've thought about ensuring that any sort of solution that we bring into our environment is enabled and to be successful in that adoption is we actually bring our stakeholders in early on. We do a lot of user research. We do a lot of inquiry to understand how they may or may not interact with a digital solution. And then we do a lot of prototyping to really understand what are those basic capabilities that need to be delivered on to solve the problem. If you're going to put a shiny new digital tool in an environment because it's the next cool thing, it's not going to be successful. If it's not easy for your end users to interact with, to engage with, and to quickly help solve their problems, you're going to be dead in the water early on. And so that's what I would encourage solution companies to really ground themselves in, is focus in on those basic capabilities that are going to drive early indicators of adoption, grounded in that human-centered design research of where your end users are in their journey and how your tool is going to enable them to be successful in solving the problem.
That's terrific. Lucky, thoughts that you have on that one? I'm sure this also extended back into some of your other industry experience, but I'm curious what you're seeing at Memorial Hermann today about getting what might often be reluctant participants, whether it's in the clinical community or the administrative community with your systems, to really pick up these tools in a manner that actually drives value.
Yeah, I think I'll double down on what Ali said, and it's a very, very valid point, is you have to understand where in the consumer experience or the journey this solution actually will apply a solution. And I think, I don't want to say that ungrounded, but just to say that in a lot of cases, we get pitched a lot of things that solve for a part of an experience that we definitely need to solve for. But the consideration of how the consumer gets to that point in the experience, the handoff between the potential experience they're coming out of and into the new experience, that all doesn't get factored into the value or the thought process in a lot of the presentations that we end up seeing. And I think a lot of that conversation has to start early on with the solution partner to say, this is how we expect it to work in the broader image and strategy of what we're trying to accomplish. And there has to be a little give and take there, a lot of conversation and a lot of partnership to build something that's seamless. Again, I mentioned it before, a point solution versus a platform approach. The reason a lot of us may be reluctant to go to point solutions is because in a lot of our digital experiences, without the right facilitation of data or design or UX UI, it truly ends up being point, and it does not integrate into the broader experiences that we ultimately want to deliver, whether that's in a clinical, operational, or consumer touch point. So I think that's really important for folks as well. I think the understanding the system's long-term goals is also very important to understand how you guys, and I say you guys, how solution partners will continue to grow with us as we achieve those outcomes over time. I think as much as we want to be told how we can solve a problem today, I also want to know how you're going to help us continue to solve that problem 2 years, 5 years from now, and how we're going to continue to evolve together on solving that problem through common facilitation of improving your product as a partnership. And I think if that opportunity exists, we have a much larger tendency to get collaboration within our system of people wanting to work with those solution partners ultimately. And we get better outcomes from the value that we drive together, because we know that we're on a journey together, not, again, just implementing something on a project basis that then everybody turns around and forgets about until the next contract renewal comes up, and then everybody's asking us, do we really still need that thing? And so I think that that's important. And so I think that that's kind of the second point I would make. And then third is, does your solution or your company actually understand the communities that we serve? And I would love to say healthcare is prescriptive across every community that there is a healthcare provider, which is every single one, obviously. But the problems that we have here in Houston may not be the same as Washington or any other state or locality that different health systems serve. And so do you even know what it means to be a Houstonian as a vendor partner, and the problems that we're trying to solve within the specific community that we have, the level of diversity that we have, or the challenges that we see across our footprint simply because of geography or other social determinant of health factors that your solution may help us solve for? And so I love to hear from my partners that they've done a little bit of research before they come to the table about the value that we're going to bring for Houston, because ultimately that is who we serve at the end of the day.
Great. I want to just shift gears a little bit. There's obviously just been tremendous dialogue about the workforce challenges that are facing the organization, with kind of the dual challenge of shortages of staff and then the resulting increase in costs, and whether it's travel nurses or overtime, things like that. Many digital solutions have at their heart some notion of efficiency, productivity, et cetera. And one of the things that we know is often a challenge is, how do you then monetize that efficiency? I think, Doug, it might have been you in a presentation of, if we make a front desk staff more efficient, you can't, have a headcount reduction of 10% of an individual. You know what I mean? That actually trying to figure out how to monetize that. So, and I know, Ali, you mentioned that you're doing a lot of work in the workforce area, but maybe Doug, I'll start with you. But what's your narrative around generating operational and labor cost efficiencies? And then how do you actually monetize those? Because you may be spending cash to bring the solution in. CFOs ask the question, where is the cash going out of my organization based on this efficiency that we're creating? So I'd love to talk a little bit about that. I would imagine many of the companies on the phone have some facet of automation or efficiency baked into their value proposition. And I would just welcome any words of wisdom from the panelists about that particular issue.
Yeah. So I'll start by saying, I totally agree with you. There's lots of solution companies that tout that, including some of the own technologies that we build ourselves. And Providence's point of view, and we're a community-led organization, similar to what Lucky was speaking to. We're often the biggest employer in all of the states that we operate as well. So we're first and foremost, we're trying to we want to take care of our own people to enable them to take care of other people. So to that Peter's point, right? We don't. If we're able to avoid phone calls coming into a clinic, it goes without saying, you can't reduce that headcount by 10% of that person at the front desk. And so that's kind of not the pitch that I want to that we want to see, right? We can't functionally do that. That cost can't be realized on the balance sheet, right? But another way of thinking about it, or just reframing that, is, hey, we're saving that person 10% of their time. That frees them up to go do something different in that clinic, right? And whether that's helping patients, get roomed, whether that's helping someone find the bathroom, whatever it may be, right? It's making that person a little bit happier and a little bit less burnt out. And that burnout in itself actually has a tremendous value, right? When you look at what it costs to replace a nurse, for example, I think you'll probably spend $80,000 to $90,000 replacing a nurse in a lot of our markets, right? So that has a real cost in itself, and it's a little bit wonkier. It's a little bit trickier to tie that hard dollar to it, but that's a real savings. We actually saw a ton of that surface. We did a lot of work with augmented scribing technologies. The cost to replace physicians and APPs and NPPs is much higher than that, right? But being able to offer that tool to those providers really helped keep them in the system for longer. We were spending less on recruiting and such. So that's the one, like kind of how we think about it. I would say if you're selling into a for-profit, an Optum, they, having been involved in those organizations, if you claim, if you're running a budget at Optum, you claim, and I guess don't quote me, but if you're running a budget at Optum and you claim, administrative savings, you actually have to achieve those on the balance sheet, right? And so they may be more willing or able to act on that, but they have different incentives, different motivations, being a company, a for-profit versus a kind of a community-led nonprofit. So that's where knowing who you're speaking to and selling into really goes a long way of what's their intention, how do they want to treat and work with their their care teams.
Great. Ali, I know that's when we prepped, I know you've got a lot of activity in the workforce experience and efficiency and automation. Would just love your take on how do you tell a value narrative around automation and efficiency, through digital?
Yeah, I really appreciate this. And I think we're all facing similar challenges in this space. One of the top strategic priorities for us coming out of the end of last year was how do we reduce the workload burden for our nurses and our physicians? So what started first was how do we provide both direct and indirect care for our patients at the bedside, reducing that burden for that bedside nurse. And to Doug's point, we really thought about from a value prop, not so much from a revenue generation. Initially, it was a cost savings because we had high turnover, we had high agency cost. And so how was a digitally enabled solution like virtual nursing going to allow us to fully capitalize on providing care for our patients quickly and at a high quality? And so where you find us right now is we're in the process of actually putting together that pro forma. And with our financial colleagues, what we're really grounding that pro forma around is what are those initial cost savings in terms of how have we reduced turnover? We've had great success in retaining talent because our bedside nurses are predominantly those who are junior in their career, especially during night shifts whenever we're really strapped from a staffing ratio. And so that virtual nurse is a more senior nurse from our experience who is not only being a mentor to that nurse, that more junior nurse, but is also there as an added resource at any point in time when that bedside nurse needs them and or the patient needs that real-time quick attention. Our virtual nurses can be there. So we're improving our nursing turnover rates. We're improving our workload burden for those bedside nurses, especially on those med surg floors where that's, I heard somebody one time refer to that as the junk drawer of hospital units. And being on those units, I can see why that term was used. But at any rate, how are we improving that satisfaction on the floors there? How are we reducing our agency spend? We had a very high agency spend, as many other organizations. We're not alone in that. Many of our nurses were going to agency because they paid better. They had better experiences at other health systems. And so we worked really hard internally to figure out how a digitally enabled solution could help retain that talent and for us to lessen the cost of that agency spend. And then we thought about automation in terms of how can we create a more seamless workflow? How does that digital tool allow us to create more automation in their workflow so that we're not requiring those nurses to spend so much of their time documenting in what we might call more administrative tasks, but really focused on direct clinical care. And that's where we found just through some of our user research that our nurses really just wanted to get back to how can I provide direct clinical care to the patient. That's what I got into nursing for. And so when we were thinking about a digital solution to enable that virtual nursing, our focus was really not just around what is the solution itself, what is our video platform. It was how are we going to deliver that direct clinical care to deliver on the needs of our nurses. And so that's a little bit of an example of how we thought about from a virtual nursing perspective around the nursing workforce. From a physician workforce, where you find us is the hot topic right now is generative AI. And this is something that I don't think anyone has a solution on how we safeguard ourselves completely. How we create guardrails. But what we're trying to really understand is all of those regulatory needs aside and absolutely critical to how we, progress in this future of healthcare. how are we delivering value to our physicians? So for us, what we're really starting to think about is how can we reduce the documentation time for our physicians? How can we track internally how much time our physicians are spending in the note, closing the note? What's that turnaround time for closing the note? Does accuracy of documentation then generate a higher reimbursement rate down the road? That's more of a lagging indicator because we're able to close the encounter sooner. We're able to see a more accurate code be billed for the level of service that was provided. And then we're also looking at it from a provider satisfaction standpoint, because what we're able to do potentially is reduce what people tend to call pajama time of our physicians spending that time outside of clinic, catching up on that documentation and closing out those encounters. So from a generative AI automation standpoint around the workforce, I think it's really important to really understand, to the point that my colleagues have made here, is what's the problem to solve? What's your audience? And then think about the value contribution in terms of cost savings. Quite honestly, the revenue generation is something, an additive that we work with our financial colleagues on, but you really need to start thinking about what are those intangible value points, and satisfaction is a huge component because turnover is rampant right now in our workforce.
Yeah, I'll add one more if you don't mind.
Please.
Yeah.
My wife happens to be a med-surg nurse, so anytime we make her life more difficult, I'm the first one to hear about it. And the digital solutions are always with the intent of making people's lives easier and more efficient, but there's often a friction in change management that is a hidden cost that we don't often consider, and our partners aren't always as transparent about with learnings that they have had with implementations they've done across the board. So I would love, as advice to our solution partners out there, please bring that to the table early and often so that we can engage the right stakeholders to understand how do we mitigate change management friction around the organization, because constant change also leads to burnout for all the things that we're trying to drive forward. And our goal is to try to get it as good as we can right the first time. And if we can do that together, I think we'll get much better return on value all over the board by having a proactive conversation.
Excellent. No, those are all terrific insights. I've got one more prompting question that I'd love to get each of you to comment on. One of the things that we often run into when we're doing financial modeling work or other types of value modeling work is the notion of how do you appropriately attribute the effect of a particular digital solution or initiative that you have, knowing that there's often many things that are happening. And I know we've had some financial people saying if we added up all of the initiatives that are trying to improve length of stay, or all of the initiatives that are trying to improve the efficiency of our nursing staff, we'd be wildly profitable, or whatever the term is. But without going into like a statistical conversation, I'm just curious how each of you approach trying to isolate the impact of a particular initiative in a manner that is not that you have to get a PhD to understand the analysis, but just really get a sense of how a particular solution partner's work might contribute toward a broader lever that you're trying to pull, and do it in a way that's credible so you can evaluate the financial cost of the solution relative to the relative impact. So Lucky, I see you nodding a little bit there, but this attribution question I know is often a really sticky point for solution partners.
Yeah, I would say that I think it starts with just the conversation about what are we really going to measure, and can we determine if there is no other factor that's going to impact that attribution that you're talking about, Peter. If there are others, are we okay with directional assumptions that progress is good enough to establish value, or do we need to get to a finite number in order to make our CFOs happy? And I think that's got to be an ongoing conversation with a lot of areas where digital solutions have traditionally not been a measured impact in specific applications that they're attempting to solve for. And so there's a question of maturity for a lot of organizations in my mind of, are you even able to measure what matters in specific cases in order to evaluate whether digital solutions, or should we spend a little bit more time making sure that the math and the science and the PhDs that actually should be doing this stuff have established a methodology for us to evaluate success, or do we feel comfortable enough with directionally that progress is good enough for us to say that this effort had value? And then how quickly can we test that solution actually had value? If we're waiting a year to establish outcomes and value, it's really hard to make strategic pivots in how we continue to evolve the conversation.
Yeah, those are great insights. Doug, I'm curious from your view. I know, some of the essential elements of your really next generation identity management concept are about things like, improving rates of new patient acquisition or increasing lifetime value of patients. And at most systems, there are many initiatives all trying to pull on those same levers. I'm curious what your thinking has been about how to isolate the specific contributions of the digital solution that you're working on.
Yeah. So I'll start by saying the art really came down to like how we instrumented the technology that we built, and that's why we started all the way upstream with like individual identity with a single set of credentials. What that did was allow us to track really at the end of one at the patient level, and be able to go all the way from like impression to click to booking to then actually seeing that surface in the in the revenue on the in cadence on the scheduled appointments, right, cadence on the completed appointment, and then actually pull it directly from our rev cycle team. So it's kind of a thread that we've been able to, I'll kind of call that identity piece, that red thread that draws through that whole platform, that allows us to really tie that together. But how we've been able to do that again with solution companies, and this I think has helped them tell better value stories to be able to actually prove out that attribution, is we can see that a patient signed up in our own digital channels and we single sign them on into an ecosystem partner, for example. So it could be one of those point solutions, or it could be a different solution company that an employer in the market offers. Whatever it may be, we can actually see that a patient started on our properties and jumped into their properties, and know that they signed up and engaged, and we can actually get to that level of attribution. And so we've kind of done it from like a heavy instrumentation approach, and I'll probably say the hard way, right, from a technology perspective. But another great way to think about it, and this is something that our marketing team has built a tremendous kind of engine around, is what I'll call just a control group, right? That you can look at, run two different cohorts of patients, have the tool turned on for a certain group, or run a specific campaign for one group, track a different group that's an isolated control group at the same time, same market conditions, same seasonality, same whatever may be going on in the market, right? And just compare the results of the two. Really simple, right? It's no different than a traditional technology company running an A/B test, but or a very similar kind of concept, right? And that lets you get to that, prove that out quickly without having to do that heavy instrumentation work. And why I like that approach versus a lot of the this is the last point I'll make, but I like that approach versus a lot of the instrumentation, or the like kind of retrospective, let's compare to a past population. So the one thing I'll say for the audience is health systems have been through a really rocky couple of years with COVID, and then the inflation pressures, right? All of our budgets and appointment volumes and all of that, like we used to be able to model in flu rates, right? But now when we look at our digital signups or digital registration engagement, it tracks COVID waves, right? Not rocket science, but it gets really hard to model that out into future years of when's that next wave going to come. Yes, we're not going through those massive waves and trying to flatten curves anymore, but that still surfaces in our data, and is really impacting how we build those budgets. So being able to just set up kind of simple control groups to get answers quickly, to Lucky's point, you don't want to wait a whole year, but get quick data, quick results is really, really important.
Great. Ali, maybe any comments you have on this issue in terms of how to isolate the impact?
Yeah, so I think both Lucky and Doug have made really great points here. And I would just add on to representing an academic organization. We work with scientists every day, and they're really grounded in what are the white papers telling us? What are publications? What are your case studies? And so for our solution partners here on the call, what I would encourage you to do, if you're not already doing, is think about how you can produce that level of data beforehand so that we as the customer can really understand how other health systems or other users have experienced value through those various different case studies are very helpful. I completely agree with Doug on the measurement of control. That's just become kind of standard practice for us, that any sort of intervention that we have, there is a control in place. I also agree with the retrospective and that philosophy. And then what I would just add is the tactics that we typically deploy, and something for our solution companies here on the call here to think through, is what are those basic capabilities that we want to quickly show value in within that solution? And how we think about the implementation then is isolating each of those capabilities to measure their impact on solving towards the problem. And that gives us a really great lens into, are there outlying contributing factors that are influencing the value derived from this, or are we truly able to isolate the value to said solution and that capability? And we just happen to do that through some agile framework in terms of sprints and what have you, that I'm sure a lot of my colleagues here have deployed as part of their process. But that's just tactically how we think about early on understanding the value that a potential solution could have through white papers, publications, clinical trials, what have you. And then as we're implementing, isolating the interventions based off of those individual capabilities through our agile mindset.
Terrific. Well, hey, we're coming up on the close of the session here. There was one question that came through the Q&A that I'm going to just adapt a little bit, just to maybe do a little bit of a lightning round. The question was about, what's the best way to reach out to you, and I'm just going to adapt it a little bit about maybe you can share. You don't have to name the company, but what's been a characteristic of someone who has approached you and you found that their narrative about value was really compelling and you wanted to have a next conversation? Were there some characteristics around that? I know, Ali, you just mentioned, for example, citing well-regarded academic articles. I think several of you earlier talked a little bit about, some version of the storytelling piece of it, but maybe just in a last closing comment from each of you, if you had one piece of advice for the solution companies that might be attending the call today, what would you be advising them in terms of, how do you come strong on the value narrative when they come and work with you? So Lucky, maybe we'll start with you.
I'll tell you, the first thing that doesn't work is cold calling during the middle of the workday for any of our solution partners out there. It's really hard to have that conversation. But, I think I kind of mentioned it earlier, is when people come to us with a perspective on how they can help us solve problems that exist within the community and have shown an interest in helping Houston become, better at being able to apply community health. I think that's ultimately a large part of the time when we'll have a good conversation about how we could leverage a technology to do something better for not only the organization, but also for the patients that we serve. And I think that always gets my attention a lot more than just, hey, we have a new nice shiny thing and some other people are doing it. And it's, if we're just trying to keep up with the Joneses, we're not really trying to customize or personalize the care that we're providing within the areas that we serve. And so it's not always about keeping up with the Joneses. Sometimes that is the case, but a large part of the time it's what strategic problems do we really need to solve, and do you have a frame of a mindset, even if it's not the correct one, to help approach us to the problem that we're trying to solve for the areas that we serve.
That's great. That's great. Doug, any parting words of wisdom for the assembled solution companies on the call?
Yeah, so I would say for me, it's just super helpful to understand what we're what I'm working on at that point in time. So we're very thesis driven organization. So I would we're trying to be proactive. We know what kind of what Lucky was speaking to, but we know what problems our caregivers are facing or our communities are facing. So often we're working on one specific thing, really trying to dive deep. And so kind of just saying, hey, is this a fit for what you're working on at this point in time? Because I think what the reality is, it's much more of a it's much more of it's not a problem. Like there's lots of folks on the phone, I'm sure, solving very different things. It's a timing issue. I'm not working on that piece of that challenge at this point in time, but that's going to change 6 months from now, 9 months from now, whatever it may be, right? So just understanding if it's a good fit for like what we're kind of currently chasing, working down at that point in time. A lot of the digital teams have been well, smaller teams, fewer resources to go after all the problems at once, right? So we're trying to just be really intentional of what exactly we're focused on. Getting top of mind, getting on people's list, right? I'll know who to jump to in 6 months if you send me a quick overview of what it is. I keep a folder of all those things, right? And so that's super helpful to be able to jump back to that and just understanding that, hey, it's not, may not be right now, but it could be right down the road. Doesn't mean it's not right down the road. That's all.
Great. Ali, last word from you.
Yeah. Oh, I feel so privileged to have the last words here. Really, if there's a secret formula to this, which I don't think there is, but let's say that we all kind of resonate around a formula, at least in my opinion, I would say first, do your homework, do your due diligence, understand the market, understand the health system and where their priorities are. My colleagues here have already articulated that. If you can start with that, you'll immediately race to the top of my inbox because, as we've all kind of said, we get a lot of cold calls throughout the week and contacts. So if you take the time to understand our business and where our problems are, and that a lot of that is public knowledge in terms of where our strategic priorities are, that'll go a long way. And then the second component to that formula would be grounding yourselves in how we think about that storytelling. I cannot underestimate the impact of storytelling and how a solution can impact our end users by the utilization of that solution. You can do a lot with storytelling in terms of how our consumers are experiencing their day-to-day lives, delivering high quality care. And if your solution can just make that experience better, that's going to be really impactful for then us to take that throughout our organization.
Great. Well, I'd like to thank our three panelists. Your insights were absolutely tremendous, and hopefully they were helpful for the group. Would love to thank the Matter organization for co-hosting this. Just did want to point out a reminder that there is a final event in the Health System Innovation Series, co-sponsored by AVIA and Matter, coming up on November 1st. It's titled Case Studies in Innovation, Stories from Health System Implementation. So hopefully everyone can join that. And again, thanks to all the attendees for joining. Hope you found it valuable, and have a great rest of your day.